Well, welcome everyone. And it's a fantastic opportunity to be able to talk about the National Transplant Program in two countries, Singapore as well as Sri Lanka. We have lined up excellent speakers, and we've got two chairpersons, one from Singapore and one from Sri Lanka. So I'm going to hand you over to both the chairs. Clinical Professor Tan is from Singapore. He's going to introduce his speaker, and Dr. Dissanayake is from Sri Lanka. So Professor Tan, if you would like to introduce the first speaker, please.
Okay, thank you. Hi, good evening, good morning, good day, everyone. I'm Chee Kiat. I'm from Singapore.
Oops.
There's some problem with the sound.
The sound is gone.
Director of our National Organ Transplant Unit. Can you hear me? Sorry. Yeah.
Yes, if you could just repeat the last few sentences, because I think there was some problem with the sound, please.
Okay. So, yeah, good evening, everyone. Good day. I'm Chee Kiat. I'm the Director of the National Organ Transplant Unit from Singapore. I'm very happy to introduce Ms. Sally Kong, who is our Deputy Director of NOTU, National Organ Transplant Unit. She's been with NOTU since its inception, so she knows everything, and she'll be giving a talk on the behalf of NOTU.
Thank you.
Sally? Yeah.
Okay, thank you. I can't share my content yet. Okay, can. Okay, good morning, good afternoon, good evening to everyone. I'd like to thank CTL for this opportunity to share about the National Organ Donation and Transplantation System in Singapore. In my presentation, I will cover some facts and statistics about Singapore, our governance structure, the legislations that facilitate organ donation and transplantation, some of our major milestones in organ transplantation, our clinical governance and quality assurance framework, our transplantation rates, the initiatives we've implemented and plans to increase organs for transplantation, and the challenges that we do face. As you can see in this map here, Singapore is a sovereign island city-state in Southeast Asia. We are at the tip of West Malaysia, and we are a little island with an area of just over 700 square kilometers. We have a resident population, just Singaporeans and Singapore citizens, permanent residents of 4 million. And we have a total population of 5.4 million in Singapore. Our ethnic composition of our resident population is predominantly Chinese with 74%, 14% Malays, 9% Indians, and 3% under others. The median age for our resident population is 41.8 years of age. Singapore is facing the silver tsunami. We have 4 working adults between the ages of 20 to 64 years of age for every adult aged 65 years and above. This ratio has been steadily decreasing. It was 10.5 in 1990, and now it stands at 4 in 2021. The life expectancy of our resident population is also increasing, with an average life expectancy of 83.9 years of age. As compared to 2010, it was 81.7. We have the females having a longer life expectancy as compared to the males. I now go on to our governance structure in our organ donation and transplant program. We have here the Ministry of Health, in short MOH, This is the Ministry of the Government of Singapore that ensures accessibility and quality of healthcare services provided to the citizens and nationals of Singapore. Transplant policy, strategies, and legislations come under the purview of the Ministry of Health. MOH is provided ethical guidance by the National Medical Ethics Committee, and this is not restricted to just organ donation and transplantation. NO2 here is the operational arm of MOH. It oversees the national organ donation and transplantation activities and operationalizes the national strategies and policies. It is also responsible for organ procurement and allocation of organs. Under NO2, we have the Advisory Committee for Transplantation, which is supported by the various organ subcommittees who provide clinical and technical advice. And in our quality assurance and credentialing framework, they also provide inputs to it. Now, under NO2, we also have a Transplant Ethics Committee, and this is different from the National Ethics Committee. This Transplant Ethics Committee oversees all our living transplants. Every living transplant to be performed in Singapore must be approved by this Transplant Ethics Committee. And for the transplant centers, the respective clinical governance framework will apply. These are the two legislations we have that facilitate organ donation and transplantation. We have the Medical Therapy Education and Research Act, in short MITRA, and the Human Organ Transplant Act, HOTA. MITRA was enacted in 1972. It is an opt-in legislation. It covers anyone regardless of nationality who is 18 years old and above, and it applies for all organs and tissues for the purpose of transplant education or research. If an individual has not made a pledge during her lifetime, the next of kin may be approached for consent for the donation. HOTA was enacted in 1987. It is an opt-out legislation. It applies to all Singapore citizens and permanent residents, 21 years and above, and not mentally disordered. The kidneys, liver, heart, and corneas are covered under HOTA only for the purpose of transplant, and authorization is by first person, which means that if a person has not registered an objection in his or her lifetime, upon death, if the organs are found suitable, they can be removed for transplant purposes. Both these legislations complement each other. This is a rather busy slide to show you the major milestones in our organ transplantation. On the left-hand side, you will see all the time points where the various programs have been established. On the right-hand side, you will see the legislations here and the amendments that we make to meet the demands and the needs in Singapore. In 1998, here, we had an Interpretation Act passed, and that was to define death, brain death, and circulatory death for the purpose of donation and also for the purpose of care of patient. In 2004 July, HOTA was amended, and it applied to all deaths. In the initial legislation in 1987, it was only accidental deaths. And we then expanded it to cover liver, heart, and corneas. And the regulations of living donor organ transplants was put in place. Now, this is with regards to having the TEC, who oversees all living donor transplants, that is, oversees all living donors to ensure that there's informed consent and the motivation of transplant is not under any coercion or duress. In 2009, there was another amendment to HOTA where the upper age limit for deceased donors was removed. In the initial 87 Act, it was capped at 60 years of age. And for living donations, we allowed for reimbursements to living organ donors to defray medical and donation expenses. We allowed for living donor recipient paired exchange, and we increased penalties for syndicated organ trading. For our clinical governance framework to address patient safety concerns and ensure minimum standards of care are met, we have put in place the Organ Transplant Regulatory Terms and Conditions, known as the OTRTCs. Hospitals that wish to provide transplant services for the kidney, heart, liver, and lung, and pancreas would have to make an application to MOH to start these services. And there is an eligibility criteria that they would have to meet, and credentialing criteria also to ensure that transplant doctors are appropriately qualified. For the post-transplant outcome monitoring, in short, PTOM is an essential component of the clinical governance framework for transplant services. It serves to monitor and improve quality of care and patient safety, and guides our policy review and development. We have also the IDM module known as the infectious disease monitoring. Now, this is to detect donor-derived blood-borne infections. So in the first year post-transplant, the centers and the clinics are required to submit the blood-borne infection results to NO2. And for donor care monitoring, all our living donors, kidney and liver donors, are monitored lifelong. These are just some of our transplantation rates. We do about 15 per million population for kidney transplants. And during the COVID period, we see a drop in it. For the liver, we do about 5 per million population. As you can see in our kidney transplantation, we do a bit more of living transplants and compared to deceased transplants. That was pre-COVID. And for liver transplantation, we do more deceased transplants than living transplants. But during COVID, it was close to be on par because of the fall in our deceased donors. For hearts, we do a very small volume, between 3 to 5 per year. These are some of the initiatives we put in place to improve organ transplantation rates. We know education and community outreach is of utmost importance. We have had the annual Live On Festival for 5 years now, where students and members of the public participate in our organ donation design and essay competitions. And this also gave us an opportunity for NO2 to go into schools, to hold talks and to facilitate discussion on the topic. For collaterals, we have mailer packages sent to Singapore citizens and PRs turning 21 years to inform them of the local legislation. And for individuals who take up residency in Singapore, this same package is also sent to them. At the hospital level, we have in-hospital committees to increase and improve communication and processes pertaining to organ donation. NO2 is represented in all the hospital committees. And importantly, to normalize organ donation and end-of-life conversations, we had the donor coordinated initiative modeled after specialist nurses in organ donation SNOTs. And we provide calibrated information in a timely manner. We encourage all ICUs to have the DCs present during these end-of-life conversations. On social media, we maintain our presence on social media to engage our community on organ donation and transplantation topics. This is our Live On website that you can locked into. And also in our initiatives, we collaborated with Nanyang Academy of Fine Arts to do a design conceptualization for our outreach activities, so that it's for them to help us to make our designs more attractive to the general public. Here we have our winning entries for our design competition and also essay. And with these winning entries, a roving exhibition is also held in hospitals, in libraries and community centers to showcase the work and increase awareness on organ donation. The plan is to increase availability of organs to improve our transplantation rates. We are now going to roll out donation after circulatory death in all hospitals. And we're looking into organ perfusion machines. We know that we are moving and having more and more extended criteria donors, and we want to increase organs for transplantation. Now, some of the key challenges that we face is strengthening clinical governance of transplant services due to our very small numbers. We have to ensure that transplant doctors maintain competency, even though our transplant numbers are small, and challenges faced in strategic development of new transplantation techniques, competency, readiness of transplant team to safeguard the safety and well-being of our donors and recipients. So to address these challenges, we have strategic partnerships with countries with more experience, and CTL is also a good platform for us to network and to reach out to these other services. Operationally, our challenges with COVID, we had to put in a fair bit of additional screening criteria for both organ donors and recipients. And if organ recipients are tested positive for COVID, they will not be transplanted. Now, challenges in implementing effective community outreach initiatives is, in addition to the current school talks, competitions around organ donation, we need to continually come up with fresh and innovative ideas to engage with our youth, and also in our general public to be innovative and effective and attractive, so that we can interest the public to educate them about organ donation. Thank you.
Okay, thank you, Sally. That was an excellent summary. So we will now move on to the next speaker. I'll let the chairman for the next speaker to introduce the speaker. Thank you.
And before that, just a quick reminder, Professor Kong, that I put it in chat. If you have any questions, please put it in chat and we'll be able to pick those up through the chat. So don't forget to put your questions in the chat. Over to Dr. Dissanayake.
Thank you very much, Satya. It's a pleasure to be here. My name is Vajira Dissanayake. I happen to be the Dean of the Faculty of Medicine of the University of Colombo, as well as the President of the Commonwealth Health Professions and Partners Alliance currently. And before that, I used to be the President of the Commonwealth Medical Association. It gives me great pleasure to introduce to you Dr. Ashani Rathnakeerthi, my colleague from Sri Lanka. She's currently honorary fellow at in York NHS Foundation Trust. But before that, she used to be the National Transplant Coordinator in Sri Lanka. So it's a pleasure to see Ashani on screen after a while. And I'd like to invite her to make a presentation on the transplant program in Sri Lanka. Over to you, Ashani.
Thank you, sir. Can you see? Good afternoon, everybody. Can you see my slides?
Not yet, no.
Yeah, Tasha.
It's coming. That's good. Yes, we can see your slides now. Thank you.
Okay.
But it has
Good
got the other
afternoon.
way around. Ashani, we see your presenter view. What you had earlier was what we would like to see. Otherwise,
Yes.
It says, Ashani, display settings button. That might help.
you can do what you did before we started the session.
Yes, yes.
Anna.
Yes, that looks good. Yes, we can see the slides now. Thank you.
Run your presentation. Run your presentation. That's fine.
Right. So, good afternoon, distinguished ladies and gentlemen. Today, I'm most privileged and honored to present to you the progress made by the National Transplant Program of Sri Lanka. So what we see here today has not always been a bed of roses. The pioneering efforts of many individuals in initiating the first ever organ transplant in Sri Lanka in 1985 is one such hallmark event. Today, we remember them with great gratitude, and following their footsteps were many who contributed in bringing the transplant program to its present standing. So at the outset, I would like to extend my heartfelt gratitude to the organizing committee for giving me this opportunity to present at this Commonwealth Forum. And I would like to start by giving you a better understanding about the demography of Sri Lanka and the statistics of the country. So we are an island nation with about a population of about 21.9 million. And our life expectancy, average life expectancy is around 76 years. And also our female life expectancy, like in Singapore, is higher. It's around 81 years, nearly 80 years. And our male life expectancy is around 73 years. And well, we spend about 4% of our GDP on health. And so this is the basic demographics of Sri Lanka. And moving on to the situation on the mortality rates due to chronic kidney disease and chronic liver disease, you can see from 2015, the disease has both diseases have escalated, and now nearly 4,000 reported cases die due to end organ failure. And we presume that the actual number could even be more. However, with the development of the deceased donor program in around 2010, we have seen an upward trend in deceased donation since 2014 up to now. And with that, you can see the blue line indicating the live donation. The live donation rates have come down. So our aim of the National Transplant Program is also to promote disease donation and to streamline the existing live donation processes. So with this trend, it's a clear indicator that we have much potential in developing our deceased donor transplant program. So the organ transplantation was performed in Sri Lanka since 1985, and we have come a long way since. We did the first deceased donor kidney transplantation in 1995. And in 2010, we had the first deceased donor liver transplantation. And 2017, we did the first simultaneous pancreas kidney transplantation. 2020, we did the first heart transplantation. And in 2021, we did the first pediatrics with liver transplantation. Things were happening, but there was no central coordination. This made the health officials in the Ministry of Health think that we need a program like the NHSPT to further develop transplant services in Sri Lanka. So this paved the way for the establishment of a national program. So today I will share with you the progress we have made as the national program since 2020. The first thing was we had to obtain cabinet approval for this sort of program, and we obtained it in late 2019. And then we had to, the existing legislature was in the Tissue Act in 1987, the Human Tissues Act of Sri Lanka, it is in 1987. So this act needed many amendments to support the current context of transplant. And the Attorney General advised us when we went to him and asked about to revising the act. He said the advice from the Attorney General's department was to develop a national policy which could expedite and facilitate the act amendment process. So with that, the National Transplant Policy was developed within a period of 2 years and was launched in February this year, just before I came for my foreign placement in the UK. So you can see the launching ceremony, that is the Honourable Health Minister, and that is the policy book, which is from 2021 to 2030. And this policy is supported by an action plan. So we were able to launch the policy as the first step. And then in the Transplant Advisory Council, this council is empowered through the Tissue Act. But since 1987, the Transplant Advisory Council was not established in a very practical manner, and time to time the council was there, and then however now when we started the national program, the council was null and void. So we reinstated the council, and now it meets very regularly and provides guidance and expertise in transplant related matters with regards to its governance. And in 2010, you could see I have just put out the circular. In relevant guidelines were developed for disease donation. However, clinicians felt that they were not empowered in taking decisions, and they needed more clear-cut guidelines as to how long they could wait and how long ICUs could be kept. So for that, to rectify that, we developed a new circular in 2021, October last year. And this also went through the Attorney General's department because there were legal implications. And now clinicians are more empowered to diagnose brain death and to promote disease donation through this circular. Then we also established guidelines to for transplant ethic review committees. So this guideline with the and also we have also collaborated with the Sri Lanka Medical Association in developing a national ethics committee, which is not in situ in Sri Lanka at the moment. So with that, which would also has a separate entity to transplant, to cover transplant related ethical issues. So this guideline, which we developed, has enabled 2 separate transplant ethics review committees to expedite transplant approval processes. And then the next thing we did was to propose a fully fledged national transplant information system. Now, this information system will provide a platform for donor and recipient registries and organ allocation systems, and which has been approved. And now this project is on its procurement stage. So once it is established, we will be doing it in 2 phases. The first phase will be the there'll be 1 national donor registry and 1 recipient list. And the second phase, when we have accredited all the transplant centers, we would go into the organ allocation phase also through the system. So which will so this will be instrumental in establishing an organ allocation system like in the developed parts of the world to ensure transparency and equity. Then we were also able to launch the first book on transplant in Sri Lanka, which was compiled to guide postgraduate trainees interested in transplant specialties. So this is the book. Many of our pioneers in transplant helped in developing this book, and this book was launched last year to promote transplant services in Sri Lanka. And also we designed, as the Ministry of Health, as the national program, we designed a certificate to honor our deceased donors for their family members as a gesture of gratitude and respect for their nobility. So this certificate would be, this would hold much weight, and this is one way we could promote deceased donation and to encourage families to sort of help us in this process. And as we all know, transplant coordinators, they are the heart of the program. So we also in Sri Lanka have appointed transplant coordinators to all hospitals with ICU facilities, so to coordinate the donation process. And most of these coordinators are medical officers who are doing this as a voluntary service apart from their general medical duties. So therefore, we are greatly indebted for their service, and we try to develop them through many capacity building programs and workshops, because these medical officers, they go on transfers. So we have a new set of, so there'll be, so from time to time, like every 6 months, we have training programs for them on training programs and workshops. This is one of the programs we had very recently during COVID. And so they are the key people who would, help or mediate this disease donation process. And also, we were able to sign a charter agreement with the Sri Lanka Air Force in early 2020, to facilitate efficient organ transportation. So the government incurs approximately around 1 million, and now it would be much more, Sri Lankan rupees per 1 charter. So this we provide helicopter facility. The major 2 retrieval teams are situated in Kandy and Colombo. So if the distance is an issue or the time is an issue and if they feel that retrieval should be done as soon as possible, therefore we actually give this facility, and we do about 3 to 4 air transportations per year. So the government funds us. But one big challenge is the sustainability of these services, because they are all provided free of charge for the citizens of the country. And we have collaborated, because Sri Lankan transplant data was not visible in the global affiliated WHO affiliated databases like GODT, which is the Global Observatory Data on Transplant, and we did not share any activity. So we collaborated with them last year and now I think we have a few issues with our data. So probably by next year, we would be able to share our transplant activity for the first time on global websites. Then we have also had discussions with the transfusion services in establishing a national tissue bank, and this is also in progress. So we will be able to establish our own national tissue bank in the blood transfusion services, National Blood Transfusion Services Unit. And we have also made arrangements to establish we have also already established 2 operational zones for achieving diseased organs covering the whole island. So this we have divided in this slide. You could see the blue line. It shows the Colombo zone, whereas the other side, the right-hand side, Kandy zone. However, there could be, as you know, at a glance, you would see sort of mismatch in the land coverage. However, we have divided the zones considering the number of ICUs in the country. So, and also we have considered the distance. So one main, the National Hospital of Kandy is the National Center for the Kandy zone, which is on the right side. And the National Hospital of Sri Lanka, which is situated in Colombo, is the National Center for the Colombo zone. So why, if now, for example, if you receive a call from an ICU regarding a brain death in DGH Mullaitivu, for example, which is a hospital in the eastern coast, the first call would go to the Kandy zone, and then if Kandy is unable to respond, then the retrieval offer will go to the Colombo zone. So this zoning was done to avoid any miscommunications as possible and possible conflicts. And at present, this has created harmony between the transplant teams, and organs retrieved are now shared amongst the 2 zones. So creating much harmony and avoiding all ambiguity. So that is why we divided the country into these 2 zones. Then teamwork is the key to success in any given context. The Ministry of Health is fortunate to have many hospital teams working in different aspects towards our common vision, and their creativity has been an inspiration to the program. The organ donation theme song was created by one team, and another team in Colombo, they did the international donor meeting, and many walks and other promotional activities. So we encourage, as the Ministry of Health, we encourage all these teams to work, and we encourage their work in promoting. And this is also one such event where we piloted the donor card, the national donor card. So this was a pilot project. Once our information system is in full bloom, we can go ahead with doing this for the whole country. Then we also we were able to incorporate an opting-in mechanism to the national driving license, and it was also launched during the policy launching ceremony. So now you can see the Sri Lankan driving license. This was launched in February this year with the same day, on the same day. And in this, you see a heart, and it says organ donors. So now Sri Lankan citizens can, so this will also promote organ donation, because then we will know the citizens will have a platform to give their consent, and this would not only help promotion, but would also be helpful for the family members to make a decision on behalf of the deceased donor. And in Sri Lanka, we have made 10 major centers that perform transplants in the government hospitals, and private hospitals mostly they perform we have only given permission for them to perform live donations, but the deceased donor program is predominantly done in the government sector. So we have 10 major centers doing transplant, And also, but however, we need a good quality assurance and accreditation system to, we are developing, we are in the process of developing it. So these 10 centers, you can see this is the first heart transplant team in Kandy, and these are the facilities we provide. And we have a new hospital where the point is a new hospital where this is called in Polonnaruwa. So this hospital is also a state-of-the-art hospital for transplants. So likewise, we are developing these centers, and we don't hope to increase the number of centers because we don't feel that transplant should be done in each center, but we are trying to more or less assure the quality and the safety of our practices in these well-established centers. And going into the transplant statistics of the government hospitals from 2014 to 2020, you can see in the total, the last line, you can see a steady increase throughout the years. So our disease donation program has really improved, and our live donation program, we actually try to streamline as much as possible to reduce any harm that could come to vulnerable communities. So that is the main reason why we are mostly promoting the deceased donor program, because we have much potential in that area. So you can see a steady increase, but in 2020, of course, like in all other countries, due to COVID, we had a slight come down, but obviously we will, the trend is always in, we have an upward trend. So, and coming to the end of my presentation on the progress made by the National Transplant of Sri Lanka since 2020, that is the program. I hope I was able to give you an overview and on the transplant program in Sri Lanka, and hope to learn and experience the UK, the systems in developed worlds, which are considered the best healthcare systems. And I sincerely hope that my learning experience in the UK also will be instrumental in steering Sri Lankan transplant services in the right direction. So thank you for giving me this opportunity. And I hope I was able to give you a small glimpse of our country. So please visit Sri Lanka. It's a beautiful island. That is my final request.
Excellent. Thank you very much for this to both the speakers and my co-chairs. One of the questions which has appeared in the chat is how can the Tribute to Life project help both these countries for organ donation as well as transplantation? Who would like to go first? Sally, would you like to go first on answering that one? How can the Tribute to Life project help you in developing donation as well as transplantation within your country?
I think in a way, this platform helps us to share our best practices and comes up with ideas of how we can improve our system or improve our outreach work and community outreach work. So I think it's the opportunity to take in the best of everybody's experiences and to apply it to your own local situation.
Sorry, the voice was not all that clear. So if you could just repeat your last sentence, that'd be helpful.
Oh, sorry. I'm just saying that the platform for CTL will help us to draw on the best practices of all the countries, you know, and come up with new ideas, what has been done in other places, what has worked, what has not worked, and whether we could apply it to our local situation to improve our standards, to improve the way we do things, to improve our donation rates.
That's good. Thank you very much. Ashani, would you like to answer that question, please?
Yes. In our context, Sri Lanka is a developing country, and at this present, times, we are facing some economic crisis as well. So providing sustainable services free of charge for the government will be very much challenging. So we are trying to see other mechanisms where we could have partnerships, where we could help sustain these programs. So that is the biggest challenge we face, and we are looking into other systems in order to see how we could sustain these services. So any ideas are welcome if you have, to help us support this program. And we are still very, our program as a national program is very, so it was only implemented. So we have a long way to go, and we would like to, we are welcome to all your support through any common forum like this. So thank you for this opportunity as well.
If you come across some of the logistics in terms of what exactly can be done, then get in touch with us. We'll be very happy to discuss, because that's the whole idea, whole ethos about Tribute to Life project, because it's talking to each other, communicating with the people who are a bit more successful in one aspect or the other, and then taking those ideas and applying it to the society that you live in. I'm going to invite my co-chairs, Professor Tan and Professor Dissanayake, to talk about the similarities and differences between the two countries. So, Professor Tan first. You've had the two presentations, but you must have noted some similarities and some differences. I'm sure all of us have noticed. How do you see it?
I think the first obvious similarity is that both systems have very enthusiastic and committed drivers. You can see from Sri Lanka, despite their setbacks, so they have a lot of drive, and it's similarly in our side. The other obvious, well, the difference is obvious, is that, Singapore is so small, we don't need to fly. So that takes a lot of logistics issues out. We can, such a small country, we basically use ambulance to deliver. So that is a big challenge in terms of a big country like Sri Lanka. I think those are the main issues, and the similarities, of course, is that everyone is trying to do is about the same organs that we're doing. We're not doing anything fancy yet, right? Not at our stage, like VCAs and transplants like that. So I think we should get our basics done, and I think the greatest demand is kidneys, livers, and heart. So let's get that, and lungs. So I think it's good that we are anchored on those first. So I think that's also a big similarity between our two countries. We are not really venturing into some experimental areas yet. Yeah.
Thank you, and thank you very much. And your views, Professor Dissanayake, about similarities as well as differences between the two countries?
Yes, I guess if I were to on the differences, I think Sri Lanka has a disproportionate burden of chronic kidney disease of unknown etiology. So that is which is a concern. So that's why, for example, Ashani showed a new hospital which is dedicated to patients with kidney diseases in the North Central province, which is expected to take on the burden of transplants that are relevant to these patients experiencing chronic kidney disease. So that is a kind of a dissimilarity, because we have that special burden of chronic kidney disease. I think similarities, of course, would be the fact that we have clinicians of equal training and experience in terms of their exposures, because of the close, I should say, kind of historic similarities of Sri Lanka and Singapore to the British connections, and as a result of that, I think the training and the expertise and skills of the clinicians of all these of all those who are involved in the transplant teams would be similar. But as I said, then the main differences would be in the burden. And of course, the current challenge that we are facing due to the economic crisis of that we experienced following the COVID pandemic, and a lot of things kind of coming together at the same point in time, is, as Ashani said, the long-term sustainability of the programs, because that's something that we need to focus on, because the economic crisis came at a time everybody least expected it. When we were actually expecting a boom in the country, we kind of experienced something completely unexpected. So that has faced special challenges, especially on special programs like the National Transplant Program. Looking at that long-term sustainability of these programs is something that we are really focusing on now. And of course, with that, to ensure their sustainability, different financial models would have to evolve, because we've been basically government-funded national health service, completely government-funded national health service with a kind of limited access private health service coexisting with it. But the current challenges would be to look at how completely taxpayer-funded national health service in the current economic context, sustain a transplant program like this. So those are my thoughts from what I heard from both speakers. Thank you, Satya.
Very interesting. In fact, the way I saw it was that in principle, we are doing the same sort of things. We are trying to develop all the things, and we are actually getting more trained and very well. We are establishing the systems for transplantation. So in principle, we are doing exactly the same thing. But the differences really are, as I saw it, the application of those principles are different. Well, partly those will have to be different because of the social needs. Partly those will have to be different because of the financial resources and the training of doctors. So those will remain there. But I think some of the differences are fairly obvious. For example, in Sri Lanka, it looks like you are developing the opt-in system, whereas in Singapore, it looks that if people have not objected, the organs will be taken, which is a very major difference because it will increase the number of organs available. So there are a few things that we can see which are obvious, and obviously not everything is going to be applicable at the same time, but obviously in due course we can all move towards better organ donation, better transplantation rates, and perhaps help our society in a much better way. But it's interesting, isn't it, that this whole transplantation is about 70 years old. So this is the youngest branch of the medicine, because all other branches of medicine are very well developed. This is the most developing but rapidly developing specialty, which I think really needs to be it needs to be grabbed in terms of opportunities. The opportunities need to be grabbed with both hands, and we need to do the best for our societies that we serve. I can't see any other questions in the chat, so I think we've still got 5 minutes. If there are any questions that anybody wants to ask, you can raise your hand and we'll be able to hopefully respond that within the last 5 minutes of this session. And that's applicable to all the panel members as well as all the participants. So if you have any questions, we might be able to take that up in last 5 minutes.
Satya, if I may add, now we were talking about the organ transplantation, the study organ transplantation, but of course, when we look around the Commonwealth, we know that even bone marrow transplantation is kind of not available. So as a Commonwealth-wide initiative, I think we also need to, you know, capture that. And I was wondering in your program project, what are the thoughts?
Yeah, very good point, Vajira. Thank you so much for bringing that up. But there are four things, aren't they? Organ donation, tissue donation, which is connected with organ donation to some extent, the blood donation, stem cell donation, and bone marrow donation. Well, we have confined ourselves to organ as well as tissue donation. We have not checked, or we have not gone into the territories of blood transfusion, or for that matter, bone marrow donation. We have not. We're not gone into stem cell donation either, for a very good reason. If whatever resources we have, if you spread it too thinly and you try to do that much, whereas if we focus our concentrated efforts on one or the two aspects, which is organ donation and the tissue donation, we are likely to succeed. So this was the reason why we chose to have organ as well as tissue donation in our territory of Commonwealth Tribute to Life. But it doesn't mean to say that there will not be any such ventures in the future, because if this is successful, and I hope it is, if this is successful, the Blood Transfusion Society or societies may say, let's connect with each other and learn from each other. Similarly for bone marrow donation and stem cell donation. So we are hoping that we establish the example first and the others may be able to follow. But at this moment, we are concentrating our efforts only on organ donation and tissue donation. Does that answer your question?
Satya would be tissue donation, because Sri Lanka, as you know, have been having a very successful global, cornea donation program that's been planning for many years. And I think there are lessons to learn from that. That has now, progressed into tissue, tissue donation program at tissue. So hopefully today we may be able to share that experience.
Yeah. Thanks. I think you're breaking up, but if I get it right, you're saying that this has progressed to tissue donation. Well, frankly speaking, tissue donation was always included in our attempt, because it didn't make any sense to do the organ donation first and then go on to tissue donation. So we always included that. So that is one good thing which has happened. But yes, others may follow. Well, I think the time is nearly up. I must thank my co-chairs, Dr. Dissanayake, as well as Professor Tan, and all the supporting staff who have actually been very helpful in making sure that all the systems work very well. Thank you to both the speakers, Sally Kong as well as Ashani. I must say it has been an eye-opener, because we didn't know so much about the situation in Singapore and Sri Lanka before this webinar. But since it's recorded, people do log in afterwards and they are able to enlighten themselves about what the situation is within these two countries. But this has been very helpful, and thank you all very, very much. Thank you to the participants, and thank you, Dale, for your questions. Grateful. Well, see you for the next webinar. All the best.
Thank you.
For now.
Okay. Thank you.
Thank you.
Thank you.
Thank you. Bye-bye.